I now request Dr. Ashisha Janila to make her presentation, please.
Hi, good morning everyone, and I'm Ashisha from Hepatology CMC, and thank you for this opportunity. So I'll be presenting our data on role of plasma exchange in acute liver failure, and the etiology we are looking at is hepatitis A-related ALF. Next slide, please. So as already said, that there is plasma exchange does improve survival in acute liver failure. However, there are no studies looking at its role in acute liver failure due to hepatitis A. Now, as already stated by the previous speakers, patients who are hemodynamically unstable, we may be too late in the game. So in this study, we also looked at patients who were hemodynamically stable, not on inotropes, with HIV ALF. Next slide, please. So now this was a retrospective multi-center cohort study, including 12 centers across India. Next slide, please. So these are the centers from whom we have data from. So we have Tamil Nadu, we have centers from Kerala, we have centers from Haryana, AIIMS Delhi, and Kochi Amrita. So overall 12 centers from where we recruited data. Next slide, please. Next slide. So the aims of this study was to compare liver transplant-free survival in hepatitis A-related acute liver failure in patients treated with PLEX as compared to standard medical treatment. We also wanted to identify an optimal window to select patients for plasma exchange in this group. Next slide, please. So this is the flow of patients in our study. So overall, hepatitis A-related ALF with 234 patients. Out of these, there were 84 patients who underwent plasma exchange and 150 patients who underwent standard medical treatment. Like I said, we also looked at a hemodynamically stable group or the PLEX eligible group who were not on inotropes. So that were 158 that you see on the left side. Out of these, 54 patients underwent plasma exchange, while 104 patients were managed with standard treatment. Next slide, please. So this is the baseline characters in the 234 patients with hepatitis A-related ALF. The first column is overall, that is all the patients with HIV ALF. And the column on the left side are patients who are hemodynamically stable, not on inotropes. So the baseline parameters were well matched between both the groups. We can see that bilirubin, enzymes, INR were all matched between the groups. Ammonia, however, was higher in the group that underwent plasma exchange. Next slide, please. Now looking at severity, we looked at various parameters like MELD, SOFA. Certain hepatitis A specific scores like alpha and ALFSG were also looked at. Here again we see the most important thing was patients who were on mechanical ventilation was different between two groups. Patients who fulfilled King's College criteria was also more in the group that underwent plasma exchange. Next slide, please. So details of plasma, the previous slide. So details of plasma exchange in the 84 patients with HIV ALF. As already pointed out, most of them underwent centrifugal plasma exchange, low volume. So many centers also did standard volume, that is 74% and 24%. As per the VELO protocol, we give low dose steroids for these patients. As we can see, line-related and transfusion-related complications were quite low. Next slide, please. So this is what I would like to draw your attention to. The first bar graphs are all the patients with HIV-related ALF. So survival was not different. As we can see, it was 70% versus 65.3%. However, when we look at the group on the left side, that is 96.3% survival with plasma exchange as compared to 77% with standard medical treatment with a significant p-value was noted in this study. Next slide, please. So this is just to highlight that this is the largest multi-center series on experience with plasma exchange to treat HIV ALF. Overall survival was not different between the groups. However, the group which was hemodynamically stable, not on inotropes, showed better survival with plasma exchange, that is 96 versus 77.9%. This group may be the window where we might catch patients for plasma exchange. Thus, I conclude with the next slide. So, as I said, there may be a role of plasma exchange. As per the study, improved native liver survival in HIV-ALF patients not on inotropes with plasma exchange. Thank you.
Thank you, Dr. Ashisha, for that presentation.